Okay, so the preliminary UCAT results are out and people are panicking. I just want to go through what is going on and to give you a bit of an idea and help you understand what to do with your application based on what you see here. Now, what I'll always say is these preliminary results always end up being a bit of a prediction game. However, if you watch the previous videos that I've done throughout the years, you'll always see that my crystal ball, for some reason, seems to work quite well. So I'm going to tell you what I would expect to see or kind of comment on what I am seeing and try and give you a bit of a rationalization behind why and what's going to happen. So the first thing to bear in mind is, and I've noticed this year, is that people are really putting off their exam. You've got about 51% of predicted test takers. So we've had 21,882 take it, and we think we're going to have another 21,000. Now, firstly, that would be a pretty high number for a given year. Usually around the 37,000 mark. But what I am seeing is a lot of students putting it off. And I think because they're feeling the pressure this year, because the exams changed. Now, typically, the people who do it in the first half are the ones who do best. That's probably down to the fact that if someone's not doing well, naturally they'll delay their exam a little bit. So the mean score always tends to come down. So that the 1939 is the preliminary score. Now, you can see here, the one last year, they've adjusted the one last year for what it was if you take out the abstract reasoning. Because remember, the exam has changed this year. Now, what I would say is don't rely too much on this because by the very nature that they've taken out a section, the nature of the exam has changed. You've got people who were focusing on a 5-element exam or a 5-section exam. Now you're focusing on a 4-section exam. So that means it's different. And that means that people, if you imagine, you've got your focus spread on fewer things. So people will naturally tend to do a little bit better in those bits, right? So we had a slightly lower reduction last year, and that's remember I predicted that last year because we had only had one exam. Last year we moved from the BMAT and the UCAT to just the UCAT. So remember those people who maybe are applying to Oxford and some of the London universities who were doing 2 exams now had their attention less spread and they were focused just on one. How much do we think this will go down? And what decile do you think that will land you in? Because that's the main thing, is where do we end up? If we're in the top decile and above, that's, gives us the opportunity probably to apply to our Oxford and Cambridges, our London universities. The lower and lower we're getting, the more we're thinking of the universities that are less heavily weighted for the UCAT or don't have a UCAT cutoff score. So where do I think this will go? So you see from here to here is actually about a 43, or is exactly a 43-point reduction. So you're looking at about a 15-point reduction per section. So that's what people are failing to see when they're going like, oh, it drops by about an average of, 50 to 60 points. So it will be about that again. Well, that is a bit simplistic to look at it like that because, like I say, we've got people focusing their attention now on just 3 sections. However, what I think is happening is there are 2 camps. There are people who, now that we've taken out the abstract reasoning, which is the thing that people could game the most, could improve the most on and get better scores on. Now that you take that out, I think you basically have 2 camps of people. The people who are able to improve their score and the people who are really, really struggling to improve their score once you take that section away, no matter how much, if they've not had the right sort of training or not going about it the right way, are struggling to get that score up. So my prediction is probably that this mean score will come down, and I know it sounds silly because I've gone all around the houses to say, it will probably come down by about 60 points, because I think we'll see a bigger drop than normal, maybe as far as 70, and I think it will be a bigger per section drop. And I think when you factor in for the fact that people are focusing more on fewer sections, that will mean that they'll do slightly better. But I think you'll have those 2 camps of people. So all in all, it kind of evens out in a way through all of that random logic that I've kind of explained. But usually, like I say, I tend to get a good feel for these things. So I reckon we're probably going to end up in a very similar sort of area. I think we'll end up about 1870 for the score. So what does that mean? What do you do in terms of applying? Where should you go to? Now, I think this is the kind of thing now where this year, with the personal statement changing and various other things, this is the time more than ever, if you've not got a great UCAT score, is to make sure you nail all of those other things. Again, I always say the UCAT's really important, but everything else is just as important. We really need to make sure that we're nailing all of that stuff. So we're getting a lot of people coming to us on the Future Doc program at this stage of the year who are really unsure because of their UCAT score. Warning, you should have come to us before. We could have helped you get a better score. But if you want to make do with what you've got, or even maybe you've got a great score and now you don't want to mess it up at the last hurdle, this is the time to come to us for a little bit of support with getting your application straight, making sure your personal statement's right, make sure you're choosing the right four medical or dental schools that are right for your situation, not just based on a UCAT score, but on everything about your application. Really worth doing that to not, not lose this opportunity now that you've got it. So if you want to find out more, you can find out about the future program. There'll be a little card somewhere on the screen. But otherwise, let's see what happens when these final results come out in a few weeks, and we'll see whether my crystal ball was right. Thanks for watching. I'll see you in the next video.